Hello, everyone, and welcome to the Virtual Roundtable on Accelerator-Produced Actinium-225, hosted by the DOE Isotope Program and with special guests from the Nuclear Regulatory Commission and a state regulator. My name is Ken Brooks. I'm a program manager for business operations in NIDC within the Isotope Program. So again, welcome. Glad you're here. Please note this segment is being recorded so we can make this available in the future for those who want to see it. Let me just go over our agenda for the day. It's pretty straightforward. I'll make some additional opening remarks, and then we're going to have a presentation about accelerator-produced actinium within the program and the efforts that have been going on and that are currently going on. Kathy Cutler will be making that presentation. Then we'll have 4 separate presentations by the NRC, as well as a state regulator. Then we'll transition to our Q&A session. Some of you have submitted questions ahead of time, and others will encourage you to submit those in the Q&A session segment on the Zoom control. If you struggle and that particular Q&A segment isn't working for you, you could just use the chat with everyone, but we prefer the Q&A feature, if you would please. Then, if time allows, after we address all the questions that are sort of NRC related, then we'll transition to some questions that are more suited for the Isotope Program. But we'll be available for you, the Isotope Program people will be available for you in various venues at various times. So we really want to focus today on tapping the expertise and knowledge of the NRC and as they're with us today. I'd like to remind us all of the Office of Science Statement on Diversity, Equity, and Inclusion. The full statement can be seen at the referenced website. The Office of Science is fully committed to fostering safe, diverse, equitable, and inclusive work, research, and funding environments that value mutual respect and personal integrity. Effective stewardship and promotion of diverse and inclusive workplaces that value and celebrate a diversity of people, ideas, cultures, and educational backgrounds is foundational to delivering on the SC mission. The scientific community engaged in SC-sponsored activities is expected to be respectful, ethical, and professional. The Office of Science does not tolerate discrimination or harassment of any kind, including sexual or non-sexual harassment, bullying, intimidation, violence, threats of violence, retaliation, or other disruptive behavior in the federal workplace, including field offices, national laboratories, user facilities, academic institutions, or other locations where activities that we support are carried out. So today, this roundtable is covered under this commitment. I would be surprised if this became an issue, but if it does, we reserve the right to remove anyone misbehaving from this meeting. Just 2 additional introductory slides here to remind everybody about the mission of the DOE Isotope Program. It's really can be thought of in sort of 4 prongs, the first of which is producing and distributing radioactive and stable isotopes that are in short supply. We also maintain infrastructure required to produce and supply these priority isotope products and related services. We conduct R&D on new and improved isotope production and processing techniques. It includes developing the workforce. And we ensure robust domestic supply chains where we can reduce U.S. dependency on foreign supply to ensure national preparedness. How do we do that? One of the ways that we do that is by tapping this vast set of resources in our country. If you take a look at this map, you will see that this is comprised of national laboratories around the nation, as well as various universities with their special assets and capabilities, and those that have joined the University Isotope Network. Of course, today we're focused on actinium-225 that is accelerator produced. And so I'll point out that as each person makes their presentation, if you would just introduce yourself at that time Later, when we get to the Q&A session, if there's a subject matter expert that is called upon, if you've not presented and introduced yourself, we'll ask you to introduce yourself at that time. So without further ado, again, welcome. Thank you for joining us today. As I facilitate our roundtable discussion, I now turn to Kathy Cutler so that she may make her presentation.
So good afternoon, everyone. So I am director of the Isotope Program at Brookhaven National Laboratory. And I'm going to talk to you today about the high energy accelerator production of actinium-225. And I do want to point out that there's a lot of people who are working on this. I'm just kind of the spokesperson who's talking about it today. So I think many of you know that there's been a lot of interest in alpha emitters. This was largely driven by a lot of preclinical work that was done by people like Martin Breckbell, Syed Mezrida. And what we're seeing now in the clinical trials is that the doses that these alpha emitters can deliver in the short range, limiting toxicity, are providing options for these patients, and which other things have not worked. So there's a lot of interest in developing radiopharmaceuticals based on these and getting them into clinical trials. A challenge has always been their availability. And the Isotope Program is spending a lot of efforts to try to bring these forward to help support those clinical developments. And one of the ones they're largely focusing on is actinium-225. It has a fairly long half-life, 9.92 days, and decays, giving off 4 alpha emissions. And can be attached to targeting vectors, showing selective uptake and retention in tumors. Oak Ridge National Laboratory is one of the first to actually supply actinium-225, and this was done from their thorium-229 stock, which they harvested from uranium-233 waste. They have provided well over 10 curies of actinium in over 2,000 packages, and they continue to do this on 4-week campaigns year-round. In the graph below, you can see that with time, Oak Ridge has increased the amount of material they can supply from the thorium-229 stocks, as well as the amount of shipments that they can provide, what is actually shown in the red line. In around 2010, the Isotope Program was getting feedback from the stakeholders that the demand of this isotope in the future was going to exceed upwards of hundreds of curies per year, and that it was going to far outstrip what these generators could supply. And that's the current situation that we find ourselves in, is that this generator is oversubscribed, and we currently have a waiting list for people who wish to use this material. So based on this, the Isotope Program looked at alternative methods that they could use to produce actinium-225. There was nuclear data that was produced from Los Alamos that showed that proton irradiations of thorium targets with about a 10-day irradiation could provide curie quantities of actinium-225. By combining the 2 high-energy accelerator facilities, this would provide material year-round, similar to other isotopes that these facilities work on to provide. Brought into this effort was Oak Ridge National Laboratory, based on their expertise in working with actinium-225 and the chemistry. This effort was initiated in 2014. Some of the initial things that were worked on was developing the target tree, but also really understanding what was produced by the proton irradiation on these thorium targets to inform the chemistry that was developed to isolate it, as well as the transportation and the waste. In 2018, based on the chemistry that was developed by this group, they actually started providing actinium-225 externally to users. Since that time, they've been increasing the amount that is supplied, producing reliably around 50 millicuries per batch since fiscal year 22. They have actually been able to produce upwards of 600 millicuries per target at the end of bombardment. There are some issues that have limited what can be provided. Some is processing capabilities, which will show you some recent developments to address this, as well as the fact that transporting a radiated target is not trivial, and that results in decay as they're transported from Brookhaven and Los Alamos over to Oak Ridge National Laboratory. There are things undergoing to increase the scalability, to increasing the target size, as well as we are working on increasing the frequency of irradiations from every 4 weeks upward to every 3 weeks. Now, just to show you the kind of flow through of the process, the thorium target is actually produced at Los Alamos, and then for Brookhaven, it gets shipped. We actually work with an external company to weld the targets. And then once the targets pass quality control, we then bombard those targets at the blip facility. And this is at radiation energies of 160 upwards to 200 MeV. The radiations last for upwards of 12 days and at a current of 165 micrograms. Once the irradiations are completed, the target is then transported over to our radiochemical research and processing laboratories, which houses our hot cells. There we can open the targets and we can either package them and send them to Oak Ridge, or as we'll show you, we can actually now do the processing of the actinium at Brookhaven, producing upwards of 50 millicuries per batch. Here you can see the new hot cells that have been refurbished at Brookhaven National Laboratory. We've completed our commissioning activities and received the approval to start operations and actually have processed actinium-225 and send it out to customers. Bringing this facility online gives the DOE Isotope Program now 2 processing facilities that they can use to supply this important isotope. This isotope was refurbished particularly for processing the actinium-225 and set up to handle the processing as well as the waste to provide it externally. The isotope program, and understanding that this material was needed for clinical trials, submitted a drug master file in December 2019 for the accelerator-produced material. This drug master file covers the material that is produced at Oak Ridge. Brookhaven is now undergoing validation batches and has plans to submit the DMF to cover material from Brookhaven in the December timeframe. The NIDC has had interactions with the Food and Drug Administration, discussing the process and what is needed to help support the use of this going forward. And as Ken pointed out, the isotope program has many avenues that it engages with the stakeholders and then works with them to ensure that we meet their needs as we move forward. Now, with the actinium-225, when it's shipped out, you will receive a certificate of analysis. This certificate of analysis has a reference date and time that's listed on it. And on this is included the amount of actinium-225 that is provided in that sample, as well as the amount of actinium-227 in that sample. It further lists the specifications and the result of those specifications on that specification sheet. As I pointed out in the beginning, one of the things that we really spent significant time on in the beginning was really understanding the thorium targets and what was produced during these irradiations. Based on that, we very much understand how much actinium-225 and actinium-227 is produced. Here, what you can see is a table that plots the actinium of 225, you see here, as well as the ratio of the actinium-227 per actinium-225. Here it is plotted per week. 0 is the end of bombardment. That's what EOB stands for. And what you can see is how the actinium-225 activity decreases with time. What you can also see in the gray and the orange line is the ratio of the 227 to the 225. And then in the red line is shown the specification limit of less than 2% for the actinium-227. The current processing of the targets occurs about 2.5 to 3 weeks post EOB, which is shown in this green box here. And the activity when we send it out, that results in about 25% of the actinium-225 that we produced EOB. And the ratio is about 0.7%, as you can see here. And again, these values are listed on the certificate of analysis that you receive. So the TriLab effort has been working towards making the actinium-225 available and supplying it externally. We have distributed over 500 millicuries. We have also used additional material in-house to make sure that we understand the specificity of this product and develop the QC trust to make sure that we control it. We now have 2 processing sites providing redundancy for this isotope. The NIDC is working with companies and research hospitals, understanding what their future needs are and preparations to support phase 1 clinical trials. The IP program, in understanding the concern with the actinium-225, put out an FOA, which they supported 3 studies looking at the impact of actinium-227. One of the outcomes of that is this paper that was published by Kate Dadachova, showing that the actinium-227 is clinically insignificant from a dosimetry toxicity perspective. And we are continuing our work to scale this up for availability. So in summary, the DOE IP has ramped up its supply to maximize domestic availability. We have upgraded our irradiation facilities, particularly by increasing the current to increase the amount that we can produce. We have brought on the new refurbished hot cells at B&L for processing and are looking at enhancing our future processing capability by adding the CART facility at B&L, the API facility at Los Alamos near the irradiation facility to increase production of alpha emitters, and then the RPF at Oak Ridge, which will greatly increase production capabilities. We have a history of doing GMP for other isotopes and have been audited by the FDA and our customers. And as shown earlier, we have submitted a drug master file to facilitate people utilizing this for clinical trials. If you have any questions or want a price quote, you can refer to isotopes.gov. And I've also included this link that includes information on actinium-225. And I thank you for your time.
Thank you, Kathy. I made mention a moment ago that we were asking you to submit your questions in the Q&A function, but for some mysterious reason in Zoom today, that's not working. So you can just submit any questions that you have into the chat for everyone, and we'll see them that way. As you have those questions during a presentation, feel free to submit them along the way. So again, thank you, Kathy. And now, Cindy, I'll turn to you.
All right, thank you. I guess I just wanted to do an audio and camera check. Is everything good?
It is.
Awesome. Okay. Well, good afternoon, everybody. My name is Cindy Flannery. I'm a health physicist on the medical radiation safety team at the Nuclear Regulatory Commission. And I really want to thank DOE for organizing this roundtable and for inviting NRC to present on this topic. We really appreciate the opportunity to talk about actinium-225 and 227. So the focus of my presentation is on the regulatory aspects for medical use licensees. I won't be covering licensing with regard to actinium production. Now, actinium-225 is being licensed for use like other unsealed byproduct material that require written directives that are regulated under 10 CFR 35.300. But the potential impurities of actinium-227 certainly create some challenges, and that impurity can be as high as 2%. And the unique properties of actinium-225, namely the alpha emission and the long half-life of the impurity 227, really places some additional requirements for the possession and use of actinium-225 that you might not have with other radiopharmaceuticals used in therapy.
Cindy, I'm sorry to interrupt you. We're
Sure.
not seeing your slides. Are you intending to share them, or do you want Christian to share those?
Oh, sorry. I thought they were up. Yeah, let me go back and see if I'm not sharing my screen here. I thought it was.
Yeah, they're not showing just yet.
Oh, okay, let's try it again. I have been having some technical issues this morning with, or today with Zoom. Christian, yeah, maybe if you don't mind sharing, that would be great.
All right, give
No
him.
problem.
And let's see, I guess I was on slide 3, actually slide 4.
So
Okay. All right, so I was talking about some of those additional requirements for actinium. So what are those additional requirements, and how do they differ from other radiopharmaceuticals used by medical use licensees? Well, the licensees will need decommissioning financial assurance. Waste will need to be handled a little differently. And I'll touch on licensing a little bit, but Sarah Forster and Megan Schober will get into a lot more detail on licensing actinium. So let's tackle the first one on this list. Next slide, please. What is decommissioning financial assurance? Well, financial assurance really just provides reasonable assurance that licensees will have adequate funds available to cover all the costs associated with decommissioning. Now, a DFP is required for a licensee with possession limits that are greater than the upper bound of the prescribed financial assurance amounts. So in this case, the licensee must perform a site-specific cost estimate to determine the amount of financial assurance required. So how do you determine the need for financial assurance? It is required for applicants requesting licensed material with a half-life in excess of 120 days. The NRC's regulations in 10 CFR 30.35 and the table in Appendix B to Part 30 are used together to determine the amount of decommissioning financial assurance, or if a DFP, a decommissioning funding plan, is required. Next slide, please. Now, because of the associated risk, long-lived alpha emitters require financial assurance at very low activities. And there are two levels of financial assurance for unsealed materials. And then there's the decommissioning funding plan that I have here. So for alpha emitting isotopes like actinium-227, the default possession value from the table in Appendix B to Part 30 is 0.01 microcuries. And using the calculation described in 10 CFR 30.35, a licensee possessing more than 10 microcuries, but less than 100, would be required to provide $225,000 in decommissioning financial assurance. To possess more than 100 microcuries of actinium-227, a licensee would be required to provide $1.125 million in financial assurance. And then a DFP would be required to possess more than 1 millicurie of actinium-227. So taking it a little bit further, assuming a 2% impurity of actinium-227, the lowest level of financial assurance at 225K is triggered at an activity of 500 microcuries of actinium-225. Something else to keep in mind with this financial assurance, if applicants are requesting more than one radionuclide, they have to use the sum of the ratios method to determine if financial assurance is needed for all radionuclides with a half-life greater than 120 days. Next slide, please. Now, with regard to a decommissioning funding plan, some facilities may already have a DFP. So the cost for decommissioning actinium-227 may or may not warrant the need to increase that financial assurance. This would really need to be considered when amending the license to add actinium. Licensees that do not have financial assurance could submit a DFP rather than the lowest amount of financial assurance, the 225K. And the cost estimate for the DFP may actually be determined to be significantly lower value than the 225K. Say, for example, facilities that don't have a significant significant number of areas of use. So for licensees seeking authorization for possession and use of actinium-225 that contains the 227 impurity exceeding 10 microcuries, this is one way to provide some regulatory relief when it comes to financial assurance. One thing to consider though with the DFP is that it must cover all areas where radioactive materials are used under the same license, not just the areas where the actinium-225 and 227 is used. Now, I do want to point out that there is a rulemaking underway to revise the values in the Part 30 Appendix B table. So how does this impact actinium-227? Well, the minimum possession threshold for financial assurance or for a DFP would decrease by tenfold. So what that means is that the financial assurance would be triggered at a lower level and the value for calculating financial assurance for actinium-227 would decrease to 0.001 from the current 0.01 value. Alrighty, next slide, please. Okay, with regard to licensing considerations, the possession limit needs to be carefully considered. A possession limit is the maximum amount of a licensee can possess at any one time. And this limit applies to all activity the site has on hand. So this would include activity to be injected, unused doses, activity from canceled patients, and any waste other than human excreta. Now, radioactive impurities as well as decay chain daughters typically are not listed on licenses, but the financial assurance requirements still apply, and it is based on the maximum amount of actinium-225 listed on the license, because that actinium-225 will ultimately affect the amount of activity of the 227 impurity possessed, and thus the requirement for financial assurance for actinium-227 if those financial assurance limits are exceeded. Now, to date, there is no guidance available addressing licensing challenges for contaminants and alpha-emitting radioisotopes, but the challenge with these impurities is not unique. There are similar issues that have arisen previously with long-lived impurities and beta-emitting isotopes, and the NRC has issued information for both lutetium-177M, the metastable state of lutetium-177, as well as yttrium-88 impurities. So I just want to spend just a minute talking about lutetium-177 when it's used for therapy. There is a lutetium-177M impurity that has a half-life exceeding the 120-day limit, like the actinium-227 impurity. But what makes this a little different is that the amount or the percentage of the impurity is much lower for lutetium-177M. So there might not be the same issues with regard to the possession limit. And also because the lutetium-177M impurity is a beta emitter, the default value for calculating financial assurance is higher, meaning that the licensee can possess a higher quantity before triggering that financial assurance. All right, next slide, please. All right, because of the long half-life, greater than 120 days, actinium waste must be transferred to an authorized recipient, like a waste broker, for low-level waste disposal. It cannot be held for decay like so many other isotopes that are used in nuclear medicine or for therapy. Licensees should have sufficient storage space to store that buildup of waste until it can be sent to a waste broker for disposal. And that waste would include things like needles, syringes, tubing, infusion equipment, and some of these other things that I have listed here. Now, it might be worth exploring whether your supplier or radiopharmacy would allow you to return the waste for disposal. And as far as detection, it appears that actinium-227 can be detected, but quantification of the 227 is a bit more complicated when detecting in waste, because there's multiple alpha-emitting progeny that have similar gamma-emitting energies. Next slide, please. And this is my last slide. Just wanted to talk about other considerations. NRC has regulatory jurisdiction in only a few states, which amounts to about 10% roughly of the nation's materials licensees. The remaining states are agreement states, and they have their own regulatory program. Their regulations may differ from NRC's regulations. So everything that I've been talking about today is for NRC licensees. Michelle will get into, in the next presentation, she'll get into more detail on the compatibility of agreement state regulations and how they may be the same or where they might differ. The last thing I want to talk about some different options for reducing financial assurance. I've kind of touched on these first two sub-bullets here, but I'll just reiterate. Some medical use applicants and licensees may not even need to take any action to comply with the financial assurance requirements. If their possession limit and total inventory of the licensed material does not exceed the limits in 10 CFR 30.35. The second sub-bullet here, I've also touched on very briefly, mentioned a case where an applicant or a licensee has the option to submit a DFP. And it might be a more cost-effective way to go using the DFP route, because the cost estimate for a DFP, the decommissioning funding plan, may be determined to actually be less than the lowest amount for the 2 levels of financial assurance. So this may address some of the concerns raised by small businesses. And the last thing here I want to talk about is an exemption. An individual licensee can always seek an exemption from financial assurance requirement by meeting the exemption request requirements in 10 CFR 30.11. And all exemption requests are reviewed on a case-by-case basis. So that begs the question, could a generic exemption from financial assurance be granted for actinium-225 and 227? There is a generic exemption right now for germanium and gallium-68 generators. NRC has currently granted a limited number of licensee requested exemptions for medical licensees that use germanium gallium-68 generators. But there's a few unique aspects to this generic exemption for the generators. And that is, licensees are still required to have financial assurance. So the exemptions that have been granted for the DFP requirement are for the DFP requirements only, and also only when certain conditions are met. And that is returning the spent generators to the suppliers. But for these licensees, they're still required to provide certification for financial assurance for decommissioning, which is those 2 lower levels of financial assurance. Also, a licensee in this case still has to request the exemption from the DFP and have the request reviewed and analyzed by NRC. So even though there's this generic exemption available, it's not an automatic exemption. So these exemption requests still need to be submitted, reviewed, and issued on a case-by-case basis. And lastly, that generator, the current generator exemption that's out right now is not a long-term generator exemption. This process is a stopgap measure to provide an alternative pending the rulemaking that will update the listed radionuclides or values, the default values, in that Part 30 Appendix B table that I had talked about earlier. So the guidance for the exemption for the germanium gallium generators will be withdrawn at the conclusion of the Part 30 Appendix B rulemaking. And if that rulemaking is ultimately unsuccessful, let's just say it was we didn't issue it or got withdrawn or whatever, the exemption guidance will be withdrawn at that time. So that kind of just sums up how generic exemptions are being handled for the the germanium gallium-68 generators. But the bottom line for actinium-227 is that licensees are always free to request an exemption from the decommissioning financial assurance requirements for actinium-227. And this would be reviewed on a case-by-case basis, where the licensee would need to demonstrate its unique circumstances that would warrant an exemption. Next slide, please. And so I've covered a lot of material in a really short amount of time. And we're going to save the questions, I think, until the second hour of this roundtable. But if you think of any questions after the conclusion of this roundtable, feel free to go ahead and submit them to this email here. So with that, I will turn it over. Thank you.
Cindy, thank you very much. That was very helpful and well presented for sure. Thank you. So next up, we have Michelle Beardsley, and I'll also, looks like Christian is reminding everybody to submit their questions in the chat. So thank you for those who are doing that. And Michelle, please take it away.
Okay, thank you, Ken. Good afternoon, everyone. My name is Michelle Beardsley, and I work in the Agreement State Programs branch at the NRC. And my specific job is I coordinate the review of all agreement state regulations that come into the NRC for a compatibility review. You could go to the next slide, please. So what is this compatibility that we talk about? Well, we have something, the commission approved a policy directive on the agreement state program, and we audit the agreement states programs so that they're adequate to protect public health and safety and compatible with the NRC's program. So in essence, they have to have regulations that don't cause any conflicts, duplications, or gaps in the nationwide regulation of agreement material. Now we have our Management Directive 5.9, because for each regulation that's being promulgated or amended, we assign what's called compatibility categories. And we go through their regulations to make sure that they meet these compatibility categories that you see listed on the right. And for category NRC, these are regulations that the NRC only can have because it's something that's under the sole authority, like type E package certificates of compliance. Only the NRC does those. So that would be an NRC category regulation. Category A, usually these have to be identical, essentially identical, because they're usually definitions and terms. So we make sure everybody's working off the same definition. For B category, these have to be essentially identical, and these are regulations that cross jurisdictional boundaries, like transportation. I mean, you want all those to be the same across the nation. So the agreement states have to have essentially identical regulations to that. For C category, this is where we kind of get into more gray areas. They have to meet essential objectives of the regulation, but they can be more restrictive. So let's say we require a written report within 30 days, and if the agreement states want it within 20 days, that would be acceptable as long as it was a category C designation. Category D, these aren't required for compatibility. However, they may be required for that adequacy part that we evaluate the agreement states on, to make sure that they're protecting public health and safety. And as I said, we do perform these audits periodically on the agreement states, and we look at their regulations to make sure that they have adopted them within certain timeframes, and that they do have all the regulations in place. For the last category, a category health and safety, these mostly are regulations that talk about like preventing exposures and things like that, like doing surveys. We may not make the agreement states be identical to ours as long as they meet that essential objective of making sure there's no contamination, in the case of like a survey requirement. You could go to the next screen, the next slide, sorry. So in this rulemaking that Cindy mentioned before, this is a table that's we're developing as part of the rulemaking working group. And these are the parts that for right now are included in that rulemaking to be changed. And she did mention the Appendix B table is included in it, and that is a B compatibility, which means that the agreement states, as far as Appendix B goes, would have to have essentially identical regulations. So their quantities would be the same as ours. There's another regulation that it's in there right now. We're not sure if that's going to stay, but that's 70.25. And that is a health and safety compatibility category. So for that, a lot of the financial assurance for decommissioning and record keeping, a lot of them are health and safety because we don't, require them to be prescriptive like, ours. They can have flexibility in how they do that because, we also have to respect the fact that every state has their own state laws and statutes that they have to also follow when they write their regulations. So we give them flexibility to, follow their own statutes as well as ours, as well as ours. And then, like I said, we do audit them to make sure that their programs are compatible with ours. And the last slide I have, like I said, for those two regulations, the compatibility category B, because we determined that those activities would cross jurisdictional boundaries, they need to be adopted in an essentially identical manner so that we have the uniformity of the regulations on a national basis. And for health and safety, they have to embody the basic health and safety aspects, and they have to be adopted but not required for compatibility. And if you wonder who makes the determination for that, we do both a technical review, and our legal counsel also reviews those to make sure that they are following, that they meet those essential objectives and that they are essentially identical. I'm sorry for that. So they go through a technical review and a legal review, and that's part of our compatibility review process. And the last slide, or was that it? That's it. Yeah. So I thank you for your time. If you have any questions, please feel free to put them in the chat, or you can contact me directly. Thank you.
Thank you, Michelle. Well done. Very helpful. On my agenda, Megan, it looks like you are up. Are you going to share your own slides today?
Let me give that a try.
Okay.
All right, it looks like it's showing for me. Is that showing for others?
It's absolutely perfect. Thank you.
Okay. Well, good afternoon. My name is Megan Schober, and I am the supervisor of the Wisconsin Radioactive Materials Program. And I want to share just some of our experience with licensing actinium-225 and actinium-227. I'm going to talk a little bit about concerns for end users, and I'll talk a little bit about concerns for licensing actinium production. I just want to start here. I know we've talked about half-life already today. We've also talked some about financial assurance. But one of the other main regulatory numbers that we use a lot as regulators is the annual limit on intake. These are values that are defined and basically limit either by inhalation or ingestion the amount of activity that someone could take into their body. And the idea is if they take in this activity, then they would meet the dose limits, either a whole body dose limit or an organ dose limit for that. And so we talk a lot about the percentage impurity, a typical the typical amount of actinium-227 that's present at the end of irradiation, or what the maximum is. And for us, the annual limit on intake is really a proxy for risk. And so I want to point out that even at low percentages of when actinium-227 shows up in very small percentages, its annual limit on intake value is 3 orders of magnitude less than the value for actinium-225. So from a risk perspective, even if you're only having 0.1% of the product be actinium-227, that makes for an equal risk between the actinium-225 and actinium-227. So that's one consideration as far as licensing. The second piece I want to mention is that this annual limit on intake value it is used as a proxy for some other things. For example, spill reporting. So if a licensee spills radioactive material and the half-life exceeds 24 hours, they are required to report spills that exceed 5 times the annual limit on intake. And so, if you spill actinium-225, most licensees are relatively capable at identifying and quantifying a spill of a 1.5 microcuries of actinium-225. But it's really a challenge to be able to identify a spill of actinium-227. 5 times the annual limit on intake is 2 nanocuries. And that's really pushing the limits of detection capabilities and what licensees can reasonably quantify. So there are some additional challenges that are present here. I just wanted to emphasize those couple of things. And then just for context, with that annual limit on intake, 5 times the annual limit on intake for spills, the reportable spill threshold for actinium-227 is actually a lower number than a leaking source report. If that actinium-227 had been contained within a sealed source, it actually has a higher threshold for being considered a leaking source than spilling unsealed actinium-227. So those are some things just in the regulations that when we go to put this into practice, they just really, we kind of have to scratch our heads and what are we going to do with this? Because some of the things are really stumbling up against what we can do in terms of precise measurements. So just to give you a flavor of the licensees that we have in Wisconsin that are using actinium, we have a number of different places where actinium has shown up already. We have several licensees that are doing benchtop research. We have licensees that are performing animal studies. And then kind of in the human pathway train, we have had licensees participate in some of the early clinical trials for actinium-225, and those drug products were passed through a radiopharmacy, ended up at a hospital for that. We do also have a licensee that's aggressively pursuing a actinium production facility. We have issued permits for the shielding design on that facility, and also the permit for basically to start the accelerator commissioning for that. So we are in active discussions with that, discussing a lot of the engineering controls and the parameters that will eventually be going into that. So when we are looking at the licensing for actinium-225, what are we thinking about? On the left are just really kind of the laundry list of things that we want to be able to make sure that our licensees have methods for addressing. And so we first began licensing actinium-225 in Wisconsin in about 2016. Prior to that, we had licensed unsealed alpha emitters, basically with radium-223. But really, those had only been approved in unit dose form, where they were basically passed through the pharmacies, passed through to the hospitals. Hospitals didn't really do any manipulation with the product. And then the waste kind of went back to the supplying radiopharmacy. So now what we're beginning to see with the actinium is it's not quite that simple anymore. So we're seeing more complex things going on. And so we're asking more questions. There has been a lot of guidance that's been put into place in the last several years. So we're grateful to the NRC for updating some of those values when it comes to, for example, action levels and those kinds of things. All right. So as we considered all of these different elements, I just wanted to provide some sense for where we landed with some of these questions that we were asking. And I would say, as a general rule, our approach has been to start with kind of the most limiting conditions and then relax where that limited default is really not reasonable. So as a general rule, we've been requiring licensees that handle unsealed alpha emitters, including actinium-225, to perform day of use contamination wipe surveys. Where we can, we've also limited what they're allowed to do in terms of chemical separation or manipulation. So, can you use unit doses only? Yes, okay, then we won't allow anything else. And no, okay, then let's talk about some other things. For action levels, we have really been pushing licensees to use action levels that are as low as reasonable. So that's based on the equipment that they have. So licensees that, for example, have a liquid scintillation counter typically have lower action levels than licensees that are using a well counter to count wipes. I do want to draw attention to training. We do require isotope specific training for a lot of these alpha users. That's based on some inspections lessons learned. And so we want that licensee training to include isotope decay, the survey requirements, the specific devices that they're using to count or measure contamination, and the reportable spill thresholds. We want to make sure as a regulator that our licensees are aware of what normal background is in their workspace and how long they need to count wipes to meet their detection thresholds. The decay and storage question, Cindy touched on, and that's the presence of actinium-227 does throw a wrench in their waste disposal options for end users. I want to spend a couple minutes talking just a little bit about the actinium production facilities. Sites that are producers of actinium have, of course, even more challenges. Right now, as the DOE mentioned, that production is really within the federal government system, but there are companies that are very aggressively pursuing actinium production in the private sector. So in Wisconsin, we have interest from the private sector to produce actinium. And so we are starting right now. We want to make smart licensing decisions that are going to limit the future potential negative consequences. So we're working to diligently assess risk and to reduce or eliminate it where possible. On the front end, because it's much easier to control these on the front end rather than trying to clean up after the fact. So the future of actinium production in many places seem to involve radium-226. So for example, when I'm talking about risk management, we are choosing to only license the amount of radium that our licensee can demonstrate that they have a need for right now. And if they need more later, we'll authorize more later, but really kind of walking in step with what they need at the present to license that now and then defer the rest to later. If product impurities are a big radiation safety risk, are there things that we can license in terms of target composition or irradiation conditions that will limit the production of those impurities to start with? And then how can the alpha waste be segregated to reduce future decommissioning challenges? So we're really thinking about this in terms of how can we limit those areas where actinium or other hazardous impurities that go along with that. How can we limit those areas of use? How can we limit those areas of storage? So as a nation, we've spent the past 100 years limiting and trying to eliminate radium-226 from industrial and medical applications. And we do know the legacy that radium-226 has left behind. And to that end, when it comes to actinium production, we really want to spend our effort on these considerations as well, with decommissioning funding plan, a robust environmental monitoring program, emergency planning that will have contingencies for spills or other potential releases, and then considering the actual security requirements that go along with larger quantities of radium. And with that, I will turn it over to Sarah.
Thank you, Megan. Very helpful, nice presentation. Sarah, are you wanting to share your own slides, or do you want Christian to share those?
If you can go ahead and share my slides, I would appreciate that.
Okay, thank you, Christian.
Thank you. Good afternoon. My name is Sarah Forster. I have been a health physicist materials licensing reviewer in NRC's Region 3 office for 12 years. My focus today is to review licensing considerations for the use of actinium radionuclides at NRC. Today I'm going to review NRC's experience authorizing actinium-225, licensing considerations requiring special emphasis when authorizing actinium-225, such as evaluating when decommissioning financial assurance is needed, when an evaluation of emergency plan triggers or an emergency plan is needed, radiation safety program considerations, waste program considerations, and how licensing conditions may be used. Other considerations for new licensees or licensees expanding their programs, regulatory resources that may be of use, and response. And then after I'm done, we will go to questions. So in terms of NRC licensing, we've seen quite a bit of growth in our licensing of actinium-225 at NRC since 2017. Prior to 2017, we only had 6 licensees that were authorized for actinium-225 of those that are currently authorized for actinium-225. All of those had decommissioning financial assurance. They generally were academic, medical, and R&D broad scope, although we did also have an academic-based limited R&D and an accelerator production licensee. NRC licensees may authorize actinium radionuclides explicitly or implicitly by listing the radionuclide on the license, such as actinium or actinium-227, specifically listing a parent in the decay chain, such as actinium-225, or radionuclide where unlisted radionuclide exists as an impurity and those other radionuclides exist as a result. Listing a broad scope authorization that includes actinium, atomic number 89, such as atomic number 1 through 92. Listing a broad scope or listing a 10 CFR medical use, such as diagnostic, 10 CFR 35.200, or therapy, 10 CFR 35.300, where the use of the radionuclide falls under that authorized use. So in terms of licensees after 2017, we also added nuclear pharmacy and other manufacturing licensees, as well as most recently, one limited medical licensee has listed actinium-225 on the license. So this slide shows kind of the growth of the different types of licenses that authorize actinium-225. The top line is a total of all of them, so you can kind of see how much licensing of actinium-225 has increased since from 2005 to 2023. We do have 3 licensees of those 23 licensees that are currently authorized for actinium-225 that are not currently subject to financial assurance. Those licensees specifically have actinium-225 listed on the license, but they are not required to submit financial assurance at this time. However, with the knowledge about the impurities and the impact that may have, this could change. We do have 1 licensee that is authorized for a curie of actinium-225. That's a limited scope R&D. We have 1 that is at that level that Cindy had mentioned, that 500 microcuries, where the impurity is going to probably be below the limits that would trigger the financial assurance requirement. And then another that is a broad scope medical that has had actinium-225 on the license for quite a while and is authorized for 20 millicuries of actinium-225. So, in terms of whether that is required, those broad scope medical licenses and those limited scope R&D licenses will have a condition on the license that limit the licensee to possession levels below those requiring financial assurance. Some of the licensees that already have decommissioning financial assurance may have their requirements expand. For example, if they are currently subject to just a $225,000 certification, but their possession levels are going to exceed those triggering the $225,000 or the $1.125 million limits, then those licensees may be required to submit additional financial assurance or a decommissioning cost estimate and funding plan. So in terms of licenses at NRC, 7 of the licenses are authorized for actinium-227 as well as actinium-225. Of those, 2 are large research universities and 2 are associated with a radiopharmacy for a separate use of actinium-227. The other 3 are for 2 other radiopharmaceutical manufacturer distributors who specifically requested to have actinium-227 listed on the license. Normally, impurities such as actinium-227 and actinium-225 are not listed on NRC licenses. 3 of the licensees are currently authorized only for actinium-227. All of those are associated with academic R&D licenses. And NRC has hundreds of medical licensees authorizing the use for any radionuclide for diagnostic or therapeutic use. Those are other places we could see actinium-225 used. NRC has approximately 100 licensees authorized for a range of radionuclides, including actinium, such as for atomic number 1 through 92, noting again that actinium has atomic number 89. As Cindy discussed, when a long-lived radionuclide such as actinium-227 is listed on the license and exceeds limits, FA is required. However, FA may be required for licenses with other licensed materials if there's a range of atomic numbers or for those medical authorizations that we talked about. In those cases, a license condition generally is placed on the license that limits the licensees to keep their possession limits below those triggering financial assurance. The only exception would be if the licensee has received an exemption. If actinium-225 is listed on the license, the licensees need to consider whether the impurities will exceed those financial assurance limits and be aware of that. If impurities will be high enough that the decay in storage could be a challenge, the licensees could consider a broader authorization, such as atomic number 84 through 92, or other range including atomic number 89. That way, all of the radionuclides that might be of concern could be covered. In terms of other requirements for licensees, something that generally won't be needed by, by the general user of actinium-225, but we are starting to see potential need for this with some of the licensees that are coming online as manufacturers of actinium-225, is that there could be a potential for an emergency plan requirement, or at least an evaluation as to whether an emergency plan applies. So in the case of unlisted alpha emitters in 10 CFR 30.72, the possession limit is 2 curies. And the unity rule also applies. So for example, if there are multiple licensees, multiple radionuclides on a given license, and the licensee, say, has iodine-131 and has a 6 curie possession limit of that, and has actinium-225 and has a 1 curie possession limit of that, when you add up the fractions, the 1 curie divided by 2 curies is 0.5. The 6 curies divided by 10 curies, which is the specifically listed number for iodine-131, will add up to 1.1, and an evaluation would be needed. Currently, with the manufacturers of actinium-225, the main thing that would be driving this is the actinium-225 possession limit itself. Currently, we only have 1 licensee of all of those licensees at NRC that has a possession limit exceeding the 2 curie limit. In that case, we would look for an evaluation as to why an emergency plan is needed or an emergency plan. The regulations specifically outline the types of things that could justify not having an emergency plan, such as physical separation in smaller quantities, storage or packaging to prevent release, physical or chemical form that would reduce the release fraction, solubility that could reduce the dose, and operating procedures or other restrictions that could reduce the dose. One of the tools that some of our licensees have used for this radionuclide, as well as for other alpha emitting radionuclides, is hotspot software, which can be used for calculating emergency conditions release. And that software can be obtained by a request to the Lawrence Livermore National Laboratory. That's currently the caretaker of that program. In terms of radiation safety program considerations, as Megan discussed, NRC is also looking at the adequacy of the licensees program and their training and their experience regarding the use of dosimetry, instrumentation, alarms, ventilation, air monitoring, release considerations, shielding, materials accountability programs, labeling, and other things. In particular, we haven't seen any unusual or novel dosimetry or inventory tracking, etc., that is needed. Although, as Megan indicated, the dosimetry and the instrumentation needs to be appropriate for the radionuclides and the hazards that are present. In terms of decay and storage waste program requirements for medical use licensees, there's a decay and storage condition that's outlined in the regulations. Essentially, that the licensees need to be considering that the radioactivity after decay and storage is indistinguishable from background, and that labels have been removed or obliterated. This is limited to short-lived materials, so the licensees certainly will need to consider whether there are long-lived materials present. They also need to consider in terms of whether the radioactivity is indistinguishable from background, whether the instrumentation that is used is adequate to detect that. And so there may need to be a different type of detection equipment than licensees may be used to using for their traditional gamma and beta emitters. So in terms of exemptions, those can be granted, but they need to be authorized by law and pose no undue hazard. And as Cindy discussed, we generally don't grant generic exemptions. The exemption that we've had in place for some time for germanium gallium generators is going to be going away once a rule is actually issued or not issued. And so licensees will need to really focus on whether there's a legal basis for the exemption. So in terms of other considerations, I think I've talked about these in terms of the materials, authorizations, whether the personnel are qualified, facilities and equipment adequacy, the distribution requirements we need to look at for some of our manufacturing facilities and for licensees receiving these and using them, whether there is an authorization to distribute for medical use or not, and licensing site visits, whether those are needed or not in terms of the types of activities that the licensee is using. This is a new application. Some licensees will require site visit, others won't. And then other regulatory authorities and how the requirements of the DOT and FDA, et cetera, would apply. If there's additional things that people have questions about in terms of licensing, NRC still uses our new Reg 1556 series volumes, and those types of issues do need to be addressed, and they need to be addressed appropriately to the radionuclide at hand. That's all I have for now. Thank you very much.
Thank you, Sarah. So as we turn our attention to the Q&A session, before we get there, I just want to emphasize a point that our director, Joanne Gillow, dropped in the chat, and I was going to mention now. There was discussion earlier in some of the licensing about producers of actinium or aspiring producers of actinium in the private sector and how there is an intended use of radium targetry and all the considerations that go with that. So just a point about today's roundtable, really, as Kathy Cutler pointed out early on, the material that we're primarily presenting today and the focus of our conversation is around the accelerator material produced by the Isotope Program, which uses a thorium target. All right, so there are no radium targets being used in the production of what we just generally are calling accelerator actinium-225. So there's no radium used, and it's a different set of considerations. It's all fine that the other information is presented, and there may be questions that you all want to handle on that separately. But as it relates to just clarity of what we're doing in the program right now, I wanted to kind of bring a point to that. So now, where from here? We have several who have submitted questions ahead of time. So I'm going to work through those in the order that are focused on NRC, and then we'll turn our attention to what's still remaining and that I've captured from the chat, and we'll go from there. But sometimes some of these questions, you know, those of you who submitted ahead of time, of course, wouldn't know what was going to be presented. So some of these questions may actually have been covered, or answers may have been covered, but just for sake of completeness, I'm going to go through them. Question 1, do the levels of actinium-227 in accelerator-produced actinium-225 require both isotopes to be declared on a RAM license in NRC agreement states. Sarah, I think maybe you were going to speak to that, or you want to address that question straight up?
Right, and I think I did point out in terms of actinium-227, if it's an impurity in the actinium-225, generally that is not something that historically NRC has required to be listed on the NRC license. However, licensees can still request to have it listed. For example, as I mentioned, for, in terms of disposing of wastes, in terms of your materials accountability programs, it may make it easier for you to manage your program if you have it listed, but it isn't something that is required if it's an impurity.
Okay, I'll just follow on to that. Do you know if any requirements related to shippers or the shipment of that material is requiring that presence of that in the RAM license? So
it is not, we have not had issues with that in terms of shipments in the past. However, we have seen kind of a growth in more specificity being asked of licensees for various, for them to ship materials. So that may be another reason that licensees may wish to list that on the license, and that
Sure.
they can get that shipper to send them what they need.
very good, thank you. Another question that was submitted reads, the co-production of actinium-227 is very detectable in the waste. It is difficult to calculate the total amount of actinium-227 in the waste to ensure we are below unconditional clearance level for disposal to the environment. Are other institutions finding the same problems, and how can NRC or DOE assist with this disposal? And I think Cindy, you were going to help us with that one.
Yeah, sure. Yeah, certainly actinium-227 may be difficult to quantify, but NRC does require that anything with a half-life greater than 120 days must be disposed of as low-level radioactive waste. NRC doesn't assist with disposal, but there are a couple of ways this could be handled. One is to transfer the waste to an authorized recipient for disposal as low-level radioactive waste. The other thing is, the other possibility is to perhaps explore whether your supplier could take back the waste from the medical use licensee for the supplier to then handle for waste disposal.
All right, thank you, Cindy.
Mm-hmm.
Another question that was submitted is, what is the current progress on acceptability of using accelerator-produced actinium-225, both from NRC in terms of safety limits and handling quantities regarding actinium-227? I think a lot of this has been covered, but Cindy, did you have any additional comments you would want to make?
Yeah, I mean, as far as my presentation, I did get into the challenges, considerations, requirements, but as far as a safety limit and handling quantities, there's not an established maximum possession limit. With regard to waste disposal, yeah, the limiting factor here is the half-life, the 120-day half-life having to be disposed of as low-level waste. As far as decommissioning financial assurance, there are a couple of different levels of financial assurance, and then the decommissioning funding plan. But these aren't really safety limits per se, rather something that needs to be kept in mind when licensing actinium-225. So that's a little bit more of a business decision.
Thank you. Another question was, even at less than 2%, the long half-life of actinium-227 means possible accumulation in the body of the patient over time may lead to induced carcinomas. What are the legal liabilities of using accelerator-produced actinium in the long term?
So as regulators, the NRC and the state regulators are not really in a position to make this determination. Now, NRC in its medical policy statement states that it does not intrude into the practice of medicine. Rather, NRC's role is to protect the workers, to protect the public, to ensure that radiopharmaceuticals are used and handled safely for patients. So I really think that this question might be better answered by a clinician.
Okay, thank you. And the last question that we have submitted ahead of time states this. Our clinical collaborator in Tampa, Florida cannot receive actinium-225 with actinium-227 present due to concerns over the radio waste having such a long half-life. I think it is a state of Florida issue. Are there any insights? So I'm not sure if Cindy or Michelle.
Yeah, I can start, but so NRC doesn't prohibit the use of actinium-225. In fact, 35-300 allows the use of actinium-225. Of course, there's some challenges to consider when seeking the authorization, but it still can be used. And those challenges are demonstrating certification for financial assurance, if the possession limits are exceeded, as well as the management of waste. But NRC's regulations do allow authorization for its use. Now, Florida is an agreement state, and Megan talked about how the state of Wisconsin, which is also an agreement state, is licensing actinium-225 to 227. So I think I'll turn it over to Megan to provide some insight on agreement state licensing.
Sure. So I guess I have a couple of comments about the that particular, whether or not we're listing the impurity and who can possess what. So we would have similar concerns that the person asking the question brought up from the state of Florida. In Wisconsin, we have a license condition on virtually all of our licenses that prohibits the possession of isotopes in quantities requiring financial assurance. And so this would prohibit the possession of actinium-227 in quantities that would exceed that 10 microcuries. This has, we have had discussions with our licensees. We have one licensee in particular that specifically was wanting to acquire accelerator-produced actinium-225 that would have the actinium-227 in it. And we had to severely reduce the requested possession limit to keep them beneath the threshold for decommissioning funding plan. So we are seeing that. We are being asked those questions. We are having to respond within the framework that we have for financial assurance and decommissioning funding plan. What this means in practice is that whenever anyone approaches us wanting actinium-225, our very first question is, what source are they getting it from? Is it generator produced? Is it accelerator produced? Where is it coming from? Is actinium-227 a possibility that they'll get that under their license? And how they answer that question drives our licensing questions. So yes, we are asking about whether they'll have actinium-227. Yes, their licenses will be severely limited if they will be possessing actinium-227. And we are engaging with our licensees to make sure that we're getting to a place that's mutually agreeable for the licensing.
So just to follow up, make sure I understood that, Megan. So if somebody was in your state, right, you can't speak for Florida, right? But
Yep.
in Wisconsin, if somebody was wanting to purchase material from the isotope program that we all know has actinium-227 in it, can they get a license to do that and conduct their research? I think the answer is yes, because you've granted that, but I wasn't sure the way that.
Yes, they can get a license. The problem is with the inventory control on the actinium-227. So their license has to do, they're going to have to, the actinium-227 will continue to build up, even though the actinium-225 decays, and they can order more. So we're really asking questions on how they are controlling the inventory of actinium-227.
Okay. Yeah, focused on that tracking and then ultimate disposal pathway, right?
Yep.
Okay, very good. All right, give me just a moment to try to organize something, and then I'll see if I can make efficient use of our collective time. Okay, so you all know, you can all see in the chat, right? Everybody sees what everybody puts in there. There's a lot of exchange, and it almost looks like a bit of, sometimes you all are kind of helping each other through, and I'm not exactly sure where to pull out the questions, but I've done what I can to try to group them and see if we can make the most productive use. So here, I'm going to give it a shot here. Okay. So are you seeing a slide that looks like snips of the chat?
Yes.
Perfect. Okay. So I'm not much able to see your faces. So some of the panel, you'll have to help me here. This looked like a string that kind of all went together, even though it came in various orders. And so Cindy, I'm going to turn to you here and see if you want to pull out, or one of your subject matter experts wants to try to speak to this thread.
Yeah, I mean, I think if I'm understanding the question, I think the question that's being asked is, an alpha emission is a very low percentage for actinium-227 compared to beta. So, would that still be the main pathway? And the answer is yes. It's still an alpha emitter, even if it's a very low fraction. So that, still would have to be considered. I think they're asking about financial assurance. So yes, it'd still be considered alpha emitter with regard to, the default values for financial assurance. Hopefully that answers the question. I said I'm not certain I understand it completely.
Well,
but,
right, it's a little hard. Sometimes it's as much comment as it is question. Or any of the other subject matter experts from the NRC want to add any comments on this? Okay. Let me move us to the next one, hopefully. Okay, here's one. It seems the ratio of 225-227 is the only consideration. What about the long-lived daughters? What are the requirements for their permanent growth in the vial? So it's related to the prior string, I think, but it seemed a bit separate, so I wasn't sure how you may want to speak to it.
I guess my initial reaction here is that looking at the daughters that they have listed here, they have relatively short half-lives. It doesn't trigger that level of 120 days, so these wouldn't apply with regard to financial assurance. So unless I'm missing something else in the question, that's, the half-life is too short.
Okay. Let me see if I can get us to the next slide. Are there published definitions for the various works?
I personally don't know this offhand unless somebody else wants to jump in.
I'm sorry, are you looking for like what the different licensees would qualify as? I'm not sure exactly, but we do have program codes that are assigned in 10 CFR parts 170 and parts 171 that kind of define different types of licensees. And we do have descriptions of what those program codes entail. So that would kind of be where those evolve. Obviously, actinium-225 licensees have grown a great deal in the past few years. So in terms of having a publication that kind of outlines those licensees beyond the slides that I provided, I'm not sure that we have a summary, but we do have documents that describe what our different program codes in our fee schedules apply to.
Okay, thank you. I'm gonna see if I can move us to the next one. Okay, I put these two on the same slide. I'm not sure they go together. I was just busy trying to capture them as they happen. So let's tackle them one at a time. Is there a need to consider the ability of hospital ERs to deal with large-scale contamination, accidents, events? I'm not sure what to do with that question, but I'll put it in the air.
As far as the first one, I don't have an answer to that. Perhaps somebody could jump in. But the second question here, is there a plan for NRC to put out licensing guidance for actinium under medical use? So how it works with our requirements is that if there's a new emerging technology or modality that doesn't fit anywhere in Part 35, then it's licensed under something called 35-1000. And we do develop licensing guidance for those technologies. As far as the actinium-225, our initial reaction to that is, it probably would be regulated under 35.300, in which case licensing guidance wouldn't be necessary. But there might be something unique about these therapies that at least might warrant a licensing memo to just kind of provide a little bit more information. But no final decisions have been made on that.
All right, thank you.
Sorry, I don't know how to answer the first one.
Yeah, I understand.
I can answer the first question. With the, in terms of the contamination accidents, all medical licensees as part of their licensing process are required to submit or commit to spill procedures. And we would expect that if a facility is using actinium-225 or have actinium-227, that their spill procedures would need to address those types of contamination incidents.
Excellent, thank you. Here's another one that was put in the chat. Great presentation. I couldn't agree more. Thank you all. And I'll let you read the question.
I don't know if perhaps an inspector or license reviewer could answer this question. I'm not really certain.
So I can throw my 2 cents in for that one as well. One of the really big challenges with the actinium-227 is that the limit on intake is so low. And so our licensing and the regulations require dose monitoring if you're likely to exceed 10% of the dose limits. So the challenge with actinium-227 with that very low value is that if you get anything, you're going to be over the limit. And so I think that's where the rubber's meeting the road in terms of the challenges with the bioassays right now. I don't know that I personally have a satisfying answer right now, but that's exactly the spot where we're thinking, and I don't know how to roll that out to the medical community at large, at least, in the places where I've seen it.
Right, and I just want to echo Megan, is that the way that we request that information from medical licensees or clinical sites is that we ask for either that commitment, well, basically a statement that they're either going to have that evaluation that shows that 10% of the limit is not exceeded, or to have the dose monitoring in place that's needed. So if there's that risk that there could be an incident where the worker could receive that dose, they need to have a plan. Maybe it's part of the emergency plan because it might not be part of the routine work processes, but a plan in place for that bioassay program. So that wouldn't be necessarily something at NRC. Now, I know some agreement states might do things a little bit differently, but at NRC, we wouldn't normally be reviewing that bioassay program, but it would be necessary to have it in place if that was a possible situation.
Okay, thank you, Sarah, for adding in there. So I've got, I think, just one more SNP that happens to have two separate questions on it. Let's see if we can get that to work here. Okay. Values in Appendix C to Part 20. Not sure that's a question, but I don't know.
I think that was a response to an earlier question.
I see.
Am I right? Maybe Vince can
That's
clarify.
probably the case. So let's focus our attention on the last one then. What accuracy is expected for quantifying residual actinium-227, syringes, catheters, absorbent bands, etc., in the waste disposal process? Anybody have any perspectives there to add from the panel?
One thing I can add, I'm not sure how important it is in terms of like quantifying. I think we need to be in agreement. It's like you can't throw it away if there's anything there. And so the question really comes down to that detection equipment. What's the lower limit of detection? How long are you counting your wipes? And what's distinguishable from background? So I think that's the broader question. I don't know, Sarah, if you have anything else you want to throw in with that.
Right, that regulation in 10 CFR 35.92, or that might be listed on license, the equivalent restrictions that might be listed on the license. Essentially, it comes down to being able to have your detection equipment that is sensitive enough to be able to detect it. And so it's about sensitivity. It's about that lower limit of detection. It's about the ability to distinguish it from background if it's there. And in terms of the quantity, that's not so important.
Okay. Thank you very much. So now what I'm going to do is shift. We've got a little bit of time. We're going to shift to questions that have been submitted ahead of time that are more directed to the Isotope program. But before I do that, I want to acknowledge a thread of theme and point to a set of resources that maybe people don't know about or might have forgotten. So let me see if this little quick move will work. Nope. Okay, give me 1 second. So there's a lot of questions around the use of the product in terms of dosimetry and considerations around patient care and so on. And I wanted to remind you two places of a workshop that was presented in September of 2021 in concert with the FDA and the NRC. So this slide is actually in two parts. The upper right part here is showing you, if you go to the FDA website and you can search for this workshop, it will get you to these four presentations that were made. You can look at the slide decks from each presenter. So if you wanted to take a screenshot of this, it's an easy way to get there. And I tested it myself. You go to fda.gov and you can just type FDA-NRC workshop and you'll quickly get there. Another place, if you wanted to see that video live, you can go to isotopes.gov and there's an information tab followed by, and you can drop down and there's actinium-225. And I've snipped at the bottom of the screen here. What you can see is there's actually a link you can click so you can watch the video recording of that meeting. And it had a lot of useful information that might speak to some of the questions that are being put forward that we won't have time to address here today. So with that, and maybe before I turn our attention to the questions that have been submitted ahead of time, Dr. Gillow, I want to see if there's anything at this juncture that you wanted to add before we'll save some minutes at the end for close, but is there anything at the moment that you would like to jump in and say?
No, I thank everyone. I think this is a really useful workshop, roundtable. In the isotope program, we're really trying to develop different production routes for actinium-225. And we do have, as some of you must know, we do distribute actinium-225 from a cow that does not have actinium-227 in it. We are also have a small cyclotron that will be coming online in the very near future, where we do irradiate radium-226 targets as well. And then we have this production line that we're talking about today. So the intention of this roundtable was not to pass judgment on one production route versus another. It was just to provide information that might be useful for those that do use actinium from this production route. We still support this production route strongly because it is able to produce significant amounts of actinium-225 without the use of without irradiating the radium-226. So we do support all of the production routes, and we're also going into the photon-induced reaction methods as well. So we thought this would be useful as there's growing interest in this particular product, and but there are still a lot of questions regarding regulations. So I'm glad to see a lot of positive comments about how this information has been useful. And we welcome input in the future if you would like to hear, to have other roundtables on other discussions that are relevant to radioisotopes or stable isotopes. We're happy to consider organizing additional roundtables in the future as well. So you can submit those suggestions to Ken. He'll be glad to receive. Thank you very much.
Okay, very well. Yeah. Okay, so you all did submit, some of you submitted questions ahead of time. So I'm going to begin to speak to those. And again, those of you of my colleagues who've not yet spoken, who know some questions are coming your way, please introduce yourself when the time comes. First up, just to mention, there was a question about how do you quantify the 2% of actinium-227 and how are these amounts communicated to customers? Well, Kathy Cutler covered that in her presentation when she went through the certificate of analysis and so on. So I think that question has been addressed. Another one was how to evaluate the many decays of actinium-225, as it will be a challenge to dosimetry for some of the quick decays. And I think, Ethan, you were going to offer some perspective on that.
Yeah, sure. So I'm Ethan Balkin. I'm the program manager for radioisotope production R&D. What I can say to this is, yeah, it is challenging. You've got something that is in solution potentially, and you've got multiple decay processes occurring simultaneously, multiple secular equilibria and transient equilibria as well. So, you know, I'm not a dosimetrist. I am not a medical physicist. I'm a radiochemist. I would rely on my colleagues in the medical physics department. They've got some wonderful MCNP based tools that are used to simulate and model dosimetry. That's where you're going to find the correct tool set. It will be a simulation, a Monte Carlo based projection that you'll need to use.
Thank you, Ethan. Another question. I'll come right back to you, Ethan. What about the radiotoxicity from the actinium-227 decay products, such as radium-223?
Absolutely. So I think you heard in Kathy's presentation, there was an FOA that was released several years ago. Several different PIs engaged in initial assessments of bioavailability and radiotoxicity. I would point to those papers. There was one paper from Kate Dadichkova that was listed, and there are several other studies that are ongoing, but I'm not in a position to comment about toxicity.
Okay. And one more for you, Ethan, and then we'll take the heat off from your plate for a minute. So in terms of radio labeling quality, what's the expected difference between the pure actinium-225 and a mix of actinium-225 with 227?
All right, so this is a chemistry question. As long as you've got a chelator or some molecule that is capable of the coordination chemistry required to bind an actinium nucleus, that chelator or small molecule doesn't pay a lick of difference to whether or not the isotopic number is 2 less or 2 more than 225. So actinium-225 will chelate or bind the same as 227, and it's a 1-for-1 radio labeling. So all labels the same.
Perfect, thank you. All right, I'm going to field a couple myself. One of them is, what is the current progress on the acceptability of using accelerator-produced actinium-225, both from the FDA regarding acceptability for use in humans? So what we can say is, of course, the NIDC gets a lot of feedback from our customers and stays in touch with them regularly. And what we can say is that we know that customers are engaged with the FDA about advancing clinical trials using this material. Of course, the details of that are proprietary and are confidential. So what details we do happen to know, we're not able to share, and even which companies are engaged in that, we're not able to share. But we can let you know that for sure there are companies that are making progress, and we're expecting clinical trials with this material to begin in the near future. Another question that's kind of similar is, why is there not actinium-225 labeled therapy in entering phase 3 clinical trials? Well, as of yet, well, first of all, we wouldn't, as the isotope program, drive clinical trials. The users of the isotopes who are then creating a drug would be the ones who would be driving that, and there just hasn't been any advance that far as of yet. We have every reason to believe that someday that answer will change, but as of yet, there's not been an advancement to phase 3 trials that we are aware of. Okay, Arn, coming your way. Has anyone performed a full acute chronic dose escalation toxicity study of actinium-225, which contains the co-produced actinium-227?
So yes, good afternoon. I'm Arn Freiberger. I'm the program manager for Accelerator facilities. So I'm the manager for these Los Alamos and Brookhaven that are producing this actinium-225. This is similar to the question that Ethan had, and so I referred you to slide 10 for a reference to Kate Dadichova's paper on the toxicity of the actinium-227. We are aware that some of our customers are performing these studies, but we do not know the results and are not at liberty to. If we knew them, we could say them probably. But right now, what we have are the papers that Kathy and Ethan referred to on the toxicity.
Thank you. Ethan, I'm coming to you with this one. What is the 1 month, 6 month, and 1 year human dosimetry if PSMA 16 is labeled with actinium-225 that contains 227 compared to the dosimetry with pure actinium at 1 month, 6 months, and 1 year? I think I know your answer, but I'll let you speak it.
No worries. So bottom line up front, we don't have that information. Dosimetry when it comes to long time scales, and a labeled product is related to what you've labeled. Those drug conjugates were developed by other people. So I would refer you to whomever is developing the latest manuscripts from PSMA 617 labelings.
Right. So we got one more that's pre-submitted, and then I think we're going to have time to answer one of the ones from the chat. So Arn, coming to you. Is any part of your DMF open? And do you have any plan for an EU submission?
So we have a DMF. It's not open, but it's available on file with the FDA for you to reference. We have no immediate plans to do an EU submission. We'll consider that in the future if the market and demand is there.
Very good. All right, I'm trying to watch all of these balancing pieces, including time. So I think we're gonna get to this one submission from the chat. See if I can get that on the screen here. Okay, not sure, Arn. We're gonna come to you as the quarterback on this one, and you can see where you want to go. Is it important to mention EOB in the C of A containing actinium-227 to know the 2% threshold limit? And I think separately, it just happens to be on this same screen, how to estimate actinium-227 at any time during the 5-week period.
So I refer everyone, both of these questions are answered on slide 9, the plot that Kathy showed. The actinium-227 ratio to 225 is determined by counting the number of days, counting the time from end of bombardment. So it's important to mention end of bombardment so that you can calculate what your ratio is going forward. And I just would like to stress that what we're plotting in that curved line, the orange and gray lines from Los Alamos and Brookhaven, is a ratio of actinium-227 to actinium-225. And so that's a ratio, and it goes up as time increases, not because actinium-227 is increasing, but the ratio increases because the actinium-225 is decreasing because of the decay. So the actual millicurie, microcurie of actinium-227 is very constant throughout this whole period. But if all you can measure is the actinium-225, then you can use that measurement and the time since bombardment to determine the actinium-227 level. I hope that can confuse everybody, but we'll see.
Thank you. Well, the ability to be able to go back and look at this recording again and see the slides and so on should help. So let me see if I can help wrap us up here. I want to share this screen in the process. Another set of resources that are available to you if you want to know more. There were a series of questions. Oh, it's not showing yet. Here we go. There were a series of questions that came in along the way, some pre-submitted, some during the chat about availability, various questions about pricing that came up that we don't have time to speak to today. But all that you can reach the National Isotope Development Center at their website at isotopes.gov. You can email directly if you want, contact@isotopes.gov. And then we'd encourage you to sign up for our listserv. We don't bombard your inbox. You might get an email once a week, once every 2 weeks, something like that. And you can subscribe to that as well. And information about actinium-225 comes out every so often, as well as other information that this community would likely find useful. My other concluding comments are just going to be a whole round of thank yous. There's a lot of effort that went into this. I know we've had extensive conversations with our NRC colleagues for the months leading up to this. So a special thank you to NRC colleagues, and as well to Megan from Wisconsin. Thank you for all your work preparing for today and then responding to questions that you had no time to prepare for. We appreciate your willingness to do this in this setting. I also thank you, those of you who submitted questions ahead of time. That did allow us a chance to be a bit more prepared and try to speak to the questions on your mind. And then, as you can imagine, there are a lot of behind the scenes work, and it would be an oversight if I didn't mention Christian Myrie and the great work that he has done to pull off today. So thank you, Christian. And lastly, somebody had to come up with the idea for this whole roundtable. So either somebody whispered in the ear of Joanne Gillow, or it came out of her own brain into my ear. But whatever the case, the idea for this today was indeed spawned by Joanne Gillow. So thank you for bringing us together in this way. And as she said, if you have other ideas where you think we can be helpful as a program by facilitating exchanges like this, we're happy to help. It's part of what we do, and we'll do our best to pull together useful events like this one. So thanks again for your participation today. If you have follow-up questions, you know how to get a hold of us, and we're here to help. Thanks so much, and have a great afternoon. Bye-bye, everybody.